Welcome back, students. We will now continue with Module 4 of our Caregiving course. I'll share my screen with you. In this module, we'll be talking about communication. So we all know what verbal communication is. It's our voice, the way we use our voice, the words that we choose, and how we say them. As important as a caregiver is nonverbal communication. Now, there are four main types of nonverbal communication. But if we look at the caregiver on the right and the caregiver on the left, we can see some pretty significant differences in the way that their body language tells us how interested they are in what we have to say. The caregiver on the right, she doesn't look like she really wants to be there. She has her hands on her hips. She's got a facial expression, an eye expression that does not invite me to further communicate with her. If we look at the caregiver on the left, look at her face, her smile. She's making eye contact. She's actually kind of crouched down to the level of the person that she's talking to. She's leaning in a little bit. She's nice, appropriate touch. So all of these things are really important to make people feel like we care about being there and we care about providing that care. When we talk about communication, we want to discuss a problem, a diagnosis that some people have, and it affects their ability to understand or express speech. It's called aphasia. And aphasia can be caused by a stroke, dementia, Alzheimer's disease, a brain injury, and anything else. It can come on suddenly because of a diagnosis, like a stroke, or it can be progressive over time. Okay, what it is someone's ability to express themselves, get their needs met. And it's interesting because aphasia can either be expressive, maybe they cannot get the right words out. For example, they might say cat instead of dog. So that's expressive. But then they might be able to understand exactly what you're saying and follow the commands that you're asking them to do. They just can't get the words out. That's expressive. But then there are people that can get the words out, but they can't understand or process what it is that you're asking them to do. So it's a very complex diagnosis. As a caregiver, I want you to know about aphasia because you could be working with someone who is getting speech therapy, and they might have an exercise program to work on. And those are normally strategies to help them work through their aphasia. People with aphasia can get better, especially if the aphasia happened because of a stroke. But it also can get worse over time. It's important to understand the body language, maybe the gestures, the way that your clients use words. I had a patient once, he could only say no, but he used no many different ways. He used it with different head movements or gestures. So his family started to learn how to communicate with him. I had a patient who had a stroke that affected her speech center of her brain, but she understood everything that was being said to her. But nobody realized that she could understand because she couldn't speak. And so for about 18 months, as she had this stroke during COVID, she was in a nursing home and people just talked over her. Nobody talked with her. Nobody asked her to participate in her care because they didn't think that she could understand. And when we asked her to move her wheelchair, to move her body, to do different things, and she could, it was life-changing for her because nobody had ever asked her. She had this stroke that left her paralyzed on one side. She was terrified. She didn't know what was going on and didn't really know she could move. So think about it from the perspective of the client or the patient not being able to express yourself or express your needs, how scary that is, how isolating that is. And so as caregivers, it's really important for us to understand this diagnosis. If we have a client with aphasia and they struggle and use so much energy to get their words out, we need to offer them and remind them that rest is really important. Maybe to use that breathing technique. If they are getting frustrated with trying to get words out, ask them to take a few deep breaths and then try again. I would caution you from always finishing the sentence of the person. If they're having word finding difficulties, let them try and find those words. This is a video of Henry. Henry has had 2 strokes, and this is what aphasia sounds like. Now, Henry can hear himself saying the wrong word. And so you can see he keeps trying to find the right word and he just can't. He also uses phrases that are familiar to him and he repeats those phrases. And this is a common speech pattern of someone with aphasia.
But wait a minute, where was it further?
What do you find most difficult about talking?
Well, just talk to you. Well, I'm an old man, you know. I've worked in my life, for all of my life. 1 minute was working home, and 10 minutes they were bang, it had gone. Oh, the first one was no trouble. I can't remember. Who am I, you know? You see, my wife died. I lost my wife. So what I was going to do? So I threw it at work, and with my limbs and my job, and different jobs and all the rest of it, and that was my life. I know it's silly for people, but that was my life, and I worked on farms, dozens of cars. At the farms, and that, yeah. And fortunately, I knew it. I loved it. I really, honestly, and all the farms, dozens and dozens and dozens around, and miles and miles and miles. But I did for work. Some in the middle of nowhere.
So you can see how much energy Henry expends trying to get his words out. And so as a caregiver, we can say, okay, let's just take a breath for a minute and try again. And, you know, we want to listen intently, give them the space, give them the time to get their words out. Now, we might find that we're working with someone with dementia who repeats themselves, who asks us the same questions over and over and over. This is a Teepa Snow video. Remember, we saw her in section 1, and it's what we can say and do as a caregiver to those types of patients or clients that we have that are repeating questions to us.
Hey, listen. Hey, baby, did I ever tell you I was from West Virginia?
Yes, you did. That's very nice.
I did?
Yes. Tell
When did I tell you that? I didn't tell you that. Who's been talking about me? Who has told you about me? See, this is what pisses me off. You and your damn big mouth. You have no business telling her. Uh-oh. Now what happens to her? She's going to get hit. What happens to me? I get drugs. What happens to her? Nothing. Who started it? Her, because she insisted I had already told her. Here's the problem. Do I remember that I've already told her? Can I remember that I've already told her? So here's what you want to do. Instead of saying, yeah, you did or no, you didn't, instead, what you want to say, here's the phrase, tell me about it. Tell me about it doesn't encourage you to lie or tell the truth. What it does is open the door, because that's really what I want you to do anyway. I want to talk. Will you listen is what I'm actually asking. When I ask, have I ever told you I'm from West Virginia? So what you want to do is just say, tell me about it. Tell me about it is the right answer. Doesn't matter whether I've told you before or not, because what it says is you want to listen. Okay, so let me give you another chance, because I'm nice. Hey, listen, honey, have I ever told you I'm from West Virginia?
Tell me about that.
Yeah, hey, look here, my grandma raised me on a farm.
Oh, really?
Yeah, hey, listen, do you know how to kill a chicken?
No, I don't.
Yeah, look here, look, take it by the neck, hold to it, and wring it round real hard. Honey, its head will pop off.
Oh, that's nice.
Do it outside, because they run and they'll bleed all over, so don't do it in the house. Make you a good chicken, though.
Yes.
Yeah, hey, listen, did I ever tell you I was from West Virginia?
Tell me about that.
Yeah, there you go. Good job. Now, when you're tired of hearing my story, because how many times am I going to tell you my story? 40. Oh, lots, because I like to have you connected. What are you going to do? Yeah, bingo. Now, here's the deal. What we used to say is, oh, don't let them tell their stories too often. That might take them back in time. You know what? There's not a thing you can do about it. And we have actually learned that reminiscing and telling those stories is a good thing. Because what you actually do when you have them tell those stories, you fire up their brain cells. And it keeps the ones they have alive, functioning, because they're burning brain cells. They're actually making them work. They're firing. It's happening. Those synapses are making those connections. That's a good thing. The other reason you want to learn those stories, as the disease progresses, I will lose the ability to tell my stories.
All right, so there you go. We want to say, tell me about it, rather than, yes, you told me already. You told me 500 times. You told me 5 minutes ago. You know, when we get frustrated, either as family members or as caregivers, those are the kind of words that come out of our mouth. And then there's, that ramping up. Then we get frustrated and they get frustrated. So tell me about it. Tell me about it. That's easy enough. Now, sometimes we might find ourselves working with clients who are a little bit aggressive because of their disease. I want you to understand that you always need to prioritize your safety. So if you are ever in a situation where you feel threatened, you need to leave and call 911. Don't ever put yourself in harm's way. These videos, these UCLA video series that we're going to watch next, they give a common response and then a recommended response. And this is when someone is verbally aggressive or physically abusive because of their disease.
I hired a caregiver to stay with my mom while I'm at work. My mother becomes mean and aggressive towards the caregiver when she tries to get her ready in the morning. Like, mom yells at her to get out and may even try to slap her away. It is a daily struggle, and the caregiver is ready to quit. I can't be with my mom every single minute, and I don't know what to do.
Tina, it's time to wake up. Let's go to the bathroom to clean up. Let's get out of bed.
I don't want to get out of bed. I don't want to get ready.
Come on, not again. Please don't give me a hard time. Your bed is wet. You need to wash up. It's 9 a.m. It's time for your breakfast and medication.
I don't feel like it. I don't need your help.
Stop it and calm down.
Don't touch me. How dare you telling me what to do? I don't need your help.
I am just doing my job. Let's get ready for the day.
I don't need you. Get out of my house and leave me alone.
People can become aggressive for many reasons. It may be an expression of pain, fear, frustration, depression, or anger. People with dementia may not understand what you're asking them to do and become frustrated. They may genuinely not understand what they need to do something, like take a pill or bathe. Aggression usually isn't personal, although it certainly feels that way. Reacting to aggression with anger, shock, or yelling only escalates the situation. First, de-escalate the situation by behaving calmly. Identify yourself if you need to. It's possible that your loved one does not recognize you. Speak to the emotions that might underlie the aggression. It could be fear, pain, or frustration. Use distraction, encouragement, reassurance, and try to be flexible if someone is being uncooperative and angry.
Good morning, Tina. This is Jane, your caregiver. Your breakfast is ready. Would you like to eat downstairs?
I like my bed. I want to stay here. You can bring my breakfast here in bed.
I can do that. I see that your bed is wet, though. I would like to make your bed so you can rest comfortably. Meanwhile, would you like to eat at the dining table?
No, I want to have my food here in bed.
Okay. How about if you eat right over here, just while I make your bed?
Okay.
Okay.
Fine.
Here are a few tips on how to respond to aggressive language and behavior. Keep it simple, one instruction or question at a time. Don't escalate tensions by being bossy or yelling. Instead, use a calming tone of voice, but do not be condescending. Provide reassurance. Let your loved one know you're there for support. Keep your body language positive and use calming gestures and gentle touch. Give ample time. Redirect or give ample time and space for cooling off and reattempt later. Remain safe. Back away slowly if the behavior is threatening. Remove or lock away all weapons like guns and knives. Call 911 if physical aggression cannot be redirected and your loved one is a danger to themselves and/or others.
Alrighty. The important thing for us as caregivers is to stay calm because our emotions are contagious. So using the breath technique that we talked about a few sessions ago, or if you are interested, you can go in and watch this segment number 3, which is called square box breathing. Again, research shows that just a few deep breaths can decrease our blood pressure, our heart rate, and that level of stress hormone that starts to circulate when we get irritated and anxious and upset. We can calm ourselves down so that we can respond as a caregiver rather than react. We always want to respond instead of react. So along with, communicating, the way that we communicate, how we communicate, we want to talk about cultural and socioeconomic diversity in caregiving. Socioeconomic differences describe people based on their education, their income, or their type of job. Households and individuals of lower socioeconomic status are more likely to suffer from poorer health, have fewer resources to buffer against the negative effects of poor health. And so, thinking about being a caregiver to someone who might be in a different socioeconomic class than us? How do we communicate? We're working with someone who's in a lower socioeconomic, maybe they don't have the education to understand, what's happening, either medically or anything else, that the way that we speak, the way that we allow them to feel like they're participatory and that they understand what's going on. Physical touch. It's another way we communicate in our society. I don't know about you, but when my family gets together, we're hugging and kissing, and we want to remember that in some cultures, physical touch is not appropriate, especially between a man and a woman. Some cultures bow to each other instead of shaking hands when they greet each other. And so we need to be sensitive to that. We want to be sensitive to areas of people's homes that they wish to remain private. Some people have rooms in their home that are designated for cultural, religious types of ceremonies, or maybe they're just areas of the house where only the family gather. So we want to just, as a caregiver, respect that, have awareness of that. And then this I have at the bottom, it seems simple, but removing shoes. Some households, it's customary to remove your shoes at the door. Now, if you're a caregiver walking into someone's house and you see shoes at the door, don't wait to be asked to take your shoes off, but offer, would you like me to take my shoes off? Now, we said it's important for you as a caregiver for protection and safety to wear good closed-toed shoes. So here's a suggestion. If it's a household where they take their shoes off, I would ask that you request to leave a pair of shoes at their home that you only use for their home, and let them know why it's important for you to keep your shoes on. Okay, for safety and protection. So that concludes Module 4. Come on back in a little bit for Module 5.